Know what this device is?
That's where you go.
Baby system, right. It comes in a bag for us back there. When we bring it to you, it's already in use. Its official name is the flow inflating resuscitation device. It's a fancy way of saying it delivers oxygen to the baby, right? There's two uses. You can use it just like a blow-by, if your child just needs blow-by oxygen, or you can use it to break a laryngospasm in a child with an airway emergency. Okay. So before we get into how do you do it, let's talk about what causes. What would you look for if you thought that your child was having an airway problem? What would you see or hear?
Retractions.
Okay. Where would you see those?
Intercostal and
Yeah, you would see them intercostal. The first place you would see would be suprasternal. I'm just gonna hold a little junior up here, right there. If a child's having an airway obstruction and they're having sternal retractions, it's gonna be right here. More so than before you see them down here. You would see them down here eventually, but what you're gonna be able to see first is suprasternal right there. And that's what it'll look like. Anything else? How else might you know?
decreased breathing sounds.
Right, but specifically, you might hear a crowing sound or a high-pitched squeal, and it would sound like that. Okay. Every time that child's trying to breathe in, it's going. The sternal retraction is going down like that. Okay, if the baby's airway is obstructed. What else might you see or hear? What about the overall color of the baby? What would you look for?
Dusky.
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 Yeah. In the first place you'd see that in an infant, blue lips. If it's an African American or a person of color, where would you look for that? That cyanotic look that we all have been taught about.
Tongue.
Inside the gum, look at their teeth line, the gum on the teeth. That'll turn blue. That pink tissue. Then by the time you see cyanosis on the nail bed, it's a little late. So sternal retractions, a crowing sound, a stridor, and cyanosis of the lips or gums or teeth. Okay? So what are some things that could cause that? What can cause a baby to have an airway obstruction? In your setting at home, in your setting here in the recovery room, not necessarily at home, but let's talk about your job here in the recovery room. I'm sorry, I interrupted you. I'm sorry. Go ahead.
Laryngospasm, secretions.
Sure, right. Laryngospasm can cause that airway obstruction. So what would happen maybe before the laryngospasm itself happened? What could cause that laryngospasm?
The secretions cause the.
Secretions are one thing. What about a closed airway? If the baby's laying on their side and their head does that, that can cause it, right? So sometimes the only thing needed is just to open the airway on the child. A closed airway can cause laryngospasm. Pediatric airways are different than ours in that their epiglottis is more curved like that, and it can flop. It's really floppy and loose, and it can flop over and block the trachea really easy. They have a lot more tissue in their mouth and throat. Tongue's bigger in comparison to overall size. It can fall back if they're sleepy. It can fall back and block the airway. If they haven't had the tonsils removed, that can block the airway. So there's several things that can cause an obstructed airway, which will lead to the laryngospasm. Okay. Factors at home, or factors that you might not be able to control that can cause a laryngospasm might be asthma. We see a lot of kids with asthma, right? What about parents who smoke in the house? Smoke in the closed up car with the windows rolled up like my parents did. Environmental stuff like that can cause predisposed children to laryngospasms as well. Okay. Also, if the patient is too sedated when we bring them to you, because they're too obtunded, and they're unable to hold their airway open, like I said, the neck drops down like that. So, the way you break that laryngospasm is first you try to position the airway open, but if he's still crowing and you're still seeing these sternal retractions, then he has a laryngospasm. What does that mean? What does laryngospasm actually mean? Any ideas?
Closed airway.
The larynx is in spasm. That's exactly what it means. So your two vocal cords here, they will slam shut, and you cannot open it. And the baby cannot open it. He's doing his thing with pressure, trying to inhale, causing more negative pressure in his lungs. Those vocal cords will not open with just that. They need pressure from the top, which is our side of the vocal cords. So no matter how much pressure this baby tries to inhale, if it's a true laryngospasm, he can't break it. So we break it with this device called the Baby Safe. Now I'm going to show you how to put it together. And I'm going to use an adult mask so I can show you how the thing works. So it has tubing on it. Everybody see the tubing? It connects to the oxygen at the wall. And it has what's called this valve. It's called a pressure relief valve. So it's just closed there. It's just closed on it. Okay. So that valve, when it's completely closed, that means that there is no oxygen or air going from this tube into the mask. All the air is going into the bag here. The more you loosen this valve here, the more it lets air flow back and forth from the baby to the bag. So I'm going to put this together on me just so you can see. So we're going to close this all the way up. If you have to use one of these, a 2 liter flow won't do it. You need like a 4 or 5 liter flow to completely inflate this bag. And I can't do it on my hand because I can't get a tight seal. So forgive me here. So the valve's closed. A tight seal on my bag. See how the bag is open? Later. Every time I inhale, the bag goes down. I exhale. Now, the more I loosen this valve, the less pressure there is on the airway. When the valve's all the way open, there's no pressure on the airway. When it's closed, it's complete pressure. What you need to break a laryngospasm is pressure on the vocal cords from above, and that's what this device does. Okay. So instead of an adult mask, obviously you have a child's mask. So you can put this in your hand, kind of hold down on it. I'm going to close this off and let you feel how this feels. Put that on your hand. Push down it tight. Now take your other hand. Open and close this valve. So you see how you open and close it? So when the baby breathes, you want to be able to let him breathe. So you don't want it all the way closed because that's too tight. So you set it so that when he breathes in and out, you do that. The other thing is when it's closed, you can give a breath. So it doubles as an ambu bag. Okay. Spasm, when you need to break that laryngospasm, you make that valve tight on their face. Like I showed you when I put the mask on. If you don't happen to have a Baby Safe and you only have an ambu bag, what could you do to break a laryngospasm that way? Any ideas? Because the ambu bag doesn't have this valve, right? Yeah, but that's going to break your seal. You got to keep a tight seal. So you've got a regular ambu bag here. We're going to pretend this is an ambu bag. So if this is a regular ambu bag, you don't have a valve, how could you use this to break a laryngospasm? Because this, when it has a valve, you can change the pressure here, right? So if you don't have a valve, just by squeezing this bag a little bit, you're putting pressure on the cords, and that'll break the laryngeal spasm. And you only need, so go ahead and grab the bag. You need to hold about that much pressure constantly. Okay, you're not trying to get my breath because the vocal cords are closed, but you're trying to break that laryngeal spasm with pressure. And you want to hold it about that much. Perfect. Don't get your feet there. There's just constant pressure. Now, how will you know when the laryngeal spasm breaks? Yeah, you'll start breathing again. Right. So, suppose you're breaking your laryngeal spasm with your baby, and it's not working. What's your next step?
Succinylcholine.
Succinylcholine, yes. Children are rate driven. If you keep their heart beating, they'll be fine. The biggest cause of respiratory arrest in children is hypoxia, which leads to bradycardia. So if you keep a child's heart beating, that's what you need to do. So succinylcholine is the answer to paralyze the child, to intubate them, but then you need to get the heart rate up, right? So you can, ventilating them will do that eventually. But while you're listening to that pulse oximeter go, boop, 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 that sound that none of us like, atropine. Atropine is the answer to get the heart rate up, okay? So in an emergency, if you can't break the laryngeal spasm with the Ambu bag or with the baby safe, you're gonna give them atropine. If you have an IV access, give them atropine, keep that heart rate up, because their heart rate will drop very quick if they're not oxygenated. And then if that doesn't work, go to the succinylcholine, intubate them, and that goes into your ACLS. Okay? So I got a little scenario here I want to go over. I think we covered most everything here. Do those. So you have a 3-year-old boy who comes to the PACU after having open reduction and internal fixation of a humerus fracture on the arm. He's healthy except for upper respiratory infection 4 weeks ago, and the parents smoke in the home. He had oral Versed pre-med, a mask induction in the operating room, and the case was done with an LMA. Everybody knows what an LMA is? Okay. The LMA was removed deep, and he arrives in the PACU breathing normally with an oral airway in place. As report is being given, the patient begins to have a stridorous noise with inspiration. Suprasternal retractions with the inspiration are noted. So we kind of covered all that already. What can cause it? What can trigger asthma, smoking in the home, previous upper respiratory infections, if the patient's still too obtunded, if he's still too sleepy and they can't maintain their airway, how you treat that if they go into laryngeal spasm, how you treat that laryngeal spasm, and then how to treat it pharmacologically or non-pharmacologically. Questions for me? No? Okay.
So would you always do the pressure first before trying the sucks? Like
Yeah.
even if they
That will
were
usually break the
rapidly
laryngeal
going
spasm.
downhill?
Yeah.
Thank you.
Yeah, if you see your baby having sternal retractions here, suprasternal retractions, before you even, that'll happen before you see cyanosis. That'll happen before you hear the pulse oximeter going down. Get that baby safe on the airway. Make sure it's tight. Close the valve, put pressure on the airway, and you'll break that laryngeal spasm. Yeah, that's your first line of treatment. Try the physical measures first. Open the airway. Try the baby safe. Hold the pressure on it. If it still doesn't work, get your atropine, get your succinylcholine, intubate the child. Anything else?
Awesome.
Thanks, y'all. Don't forget to sign.
Thank you.
You're welcome. Anytime.